this morning before we moved on, just to emphasize some of the things. And you'll read the basic outline in your notes about the swarm fly. We spoke about that yesterday. We spoke about how the fly, the female mates once in their lifetime. So the way they try to control it is with the irradiated fly technique, where they basically sterilize the male flies with radiation. So this started in the 1950s. USDA Agricultural Research Service developed this method called sterile insect technique. So the reason the male flies are infertile is they're irradiated and then they're released, and the females mate wands hopefully with the sterile male fly, and then no offspring results. So they started using this in the United States in the late 50s, 1957, eradicated the flies from the entire southeast of the United States by 1959, and applied more extensively in 1962. Excuse me. By 1966, self-sustaining schoolworm populations were eliminated from the United States. That's pretty neat. So that's a pretty good success record. From the 50s to the mid-60s, we eliminated an entire population of parasites from the United States. So that's very cool. But it's an ongoing process. The case that I told you about yesterday was actually in a dog. September 2007, screwworm larvae were found in a dog. There was another case that they had in the news where the guy brought in screwworms in his hair. But this was 2007, found in a dog, recently entered the United States from Trinidad and Tobago. An alert private veterinarian detected the larvae, and then they tracked the dog's movements from Florida to Mississippi, disinfected the site where the dog spent time, prevented any spread of the pest. And any of you guys planning to go into some federal agencies when you graduate? USDA? Good. So yeah, so this is kind of fun, exciting stuff you'll be doing. Epidemiology Intelligence Service, EIS. Anybody interested in epidemiology? One person, excellent. I'd say maybe like that. It's not a bad thing. It's fun. Some of us have graduate degrees and training in epidemiology, but anyway, I digress. In May 2010, a similar incident occurred when a private vet found screwworm larvae in a dog that traveled from Venezuela to Florida. So, again, it's just a matter of vigilance, okay? And I guess what this highlights is the role of a private vet, an alert private vet, a private vet. So you guys are going to have a role to play in disease control and prevention too. Even though you don't think of yourself as epidemiologists or involved in public health, you really are going to be involved in public health. It's funny, when I was going to UAB to do public health, the question I always got in the School of Public Health was, oh, you're a veterinarian? Why are you in the School of Public Health? So a lot of human public health people don't realize the role of veterinarians in public health, but you know, that's their loss. You guys have to know your work and know what you're doing. And let's see. And again, just briefly talking about our friend, the rare tiny key deer surviving the flesh-eating worm. I love that headline, by the way. It really grabs your attention. And let's see. So what were the stakes back in 2016? Let's see. So let's see. All right. So how do they control it? Sterile screwworms released to stop them from reproducing. Releases scheduled for twice a week for 25 weeks until the fly is wiped out. So that's a lot of work, right? A lot of time and effort, a lot of money spent. So what were the stakes? Let's see. Okay, so they had 70 dead deer in a herd estimated at just 800 to 1,000. All right, so there's only 800 to 1,000 of these little deer out there, and unchecked, this disease could have wiped them out. So, so action was taken pretty quickly and effectively to eradicate this infection. All right. And another quote I like from this article. Any of you guys watch that nasty show, Walking Dead?
Thank you.
Yeah. Yeah, the worm is like the walking dead of pests, feasting on the exposed tissue, living warm-blooded animals. This was a very gifted writer, the person who wrote this article. I like some of the phrases they use. So that really grabbed your attention, right? Some of you and other stuff. Did it grab your attention? Yeah. Are you guys here? Hello? Yeah. All right. The worm is like the walking dead. I like that. I don't care. I like the phrase. All right. And then they talk about, so they talk about some other stuff. But the key thing, when you're dealing with the public, the key thing is to catch their attention and to get their support. And, so it's a federal effort using taxpayers' money. So it's important to get the public support when you're doing things like this. And, if you have any sort of heart at all, that headline really does it. The rare tiny pea bear survived a flesh-eating worm. I wish I did something like that. That's pretty cool. Really captures your attention. What I want you guys to get out of it when you read that section on screwworm, hopefully you've also been taking note on what I've been presenting here. You might want to make note of the species, the New World screwworm fly, Papillomaia hominivorax. If you see it in a multiple choice question, hopefully you recognize it. Starts with a C, but so does the Old World screwworm. So the Old World screwworm fly is Chrysomia. And there are a few other species, but for exam purposes, you'll probably just see these two species highlighted. So try to remember which one is which. Papillomaia hominivorax, New World screwworm fly. Here's New World. This is where we are, guys, in the New World. And Chrysomia praetoria, one of the Old World screwworm flies. So there's a number of Old World screwworm flies. One of them is Chrysomia, and this is the Old World here. Old World. All right. So make sure you make note of that. So now we're going to move on to the diseases, skin diseases that are caused by helminths. And these are fairly common. Habernemyces, cutaneous onchocerciasis, oxyuriasis, and staphylophilariasis. So you can read through them in your notes. You'll notice, for example, when we started talking about Habernemyces, I remember yesterday we said it was spread by the stable fly, Stomoxys. It can also be spread by the housefly as well. But most of the fly population you're going to see out in the stable are in fact stable flies or Stomoxys. So it can be spread by stable flies as well as houseflies. And in the notes, we mentioned Stomoxys, the stable fly, as well as the housefly, Musca domestica. And these flies are laying eggs at the mucocutaneous junctions, and the eggs are hatching and entering the skin. And what's happening is that you're getting hypersensitivity reactions. So the hallmark of these helminth infections is that what the body is doing is it's responding with a hypersensitivity reaction to the presence of these larvae that are feeding on the skin. So we mentioned in the notes about Habernema, L3 larvae. You guys remember parasitology when we spoke about L1, L2, L3. So yeah, so I'm not going to torture you with that, but it is the L3 larvae that are causing the hypersensitivity reaction. And basically what you're seeing is a papillomacular type of reaction. In the notes, as far as your differentials, make note of the differentials for haplodermitis, because you see that in different places, in different exams, your national boards and so on, in NATLI. They'll present a horse, it'll have a papillonodular lesion on its body, and you'll have to try to come up with differential. The differentials that are listed in the notes are sarcoids, exuberant granulation tissue, and neoplasia. So basically they all look alike. They all look like papillonodular lesions on the extremities of the animal. And then the best way to differentiate what is causing these lesions is to do a biopsy. So remember, yesterday we spoke about your diagnostic techniques, and biopsy, histopath, as well as skin scrapings are going to be your two most commonly used diagnostic tests for the integumentary system. The treatment is basically surgical removal, and then try to prevent it reoccurring with topical anti-inflammatories, and that's going to hold true for most of these. Cutaneous onchocerciasis is a little more difficult to treat. It's spread by these culicoides gnats, and it tends to occur in horses. One of the common lesions that we talk about in the notes is the depigmented or bullseye lesion on the forehead. It doesn't really look like a bullseye. It just looks like a patch of skin on the forehead, and it's also depigmented. So if you see that lesion, that's fairly characteristic. So what you're getting for your clinical signs is depigmentation and hair loss, and then you basically make your definitive diagnosis with a biopsy and submit sample to histopath. But usually you make a diagnosis just based on the clinical finding of the characteristic lesions. The thing that makes this difficult to treat, as we said in the notes, is the adult onchocerca lives in the mucous ligament, and as you can imagine, it's hard to get drugs that will penetrate into ligaments. So it's difficult for you to treat. If you're trying to kill the adult that's producing the microfilaria, then you're talking about something like ivermectin over a prolonged period of time. And as we said in the notes, the adults live up to 20 years, and recurrence is possible in 6 to 12 months. Bottom line, you're going to tell your clients that this is a chronic disease that you can treat. It may clear up, but then it might flare up again. So you're going to have to be prepared to treat it more or less continually. Oxyuriasis or pinworms. One of the characteristic lesions is the so-called rat tail, where the pruritus or the itching sensation causes the horse to rub its hind end, and over time it can rub the hair off of the tail, and you get that so-called rat tail. So pinworms, Oxyurus equi, pinworm of horses. And with this one, the thing to be aware of as you read the notes is where the adults live in the cecum and colon, and then the females will migrate out at night. They'll lay eggs in the perianal area, and then they'll go back inside. And I guess the cement or the secretion that they use to attach the eggs perianally sets up inflammation and sets up itching. So the horse is trying to relieve the itching, and that's when they get that rat tail as they try to scratch. Your diagnosis is pretty much based on the characteristic lesion. If you see a horse looking like that, and I didn't include pictures showing how bad it can get. You know, they can rub all the hair off their tails, and they just have a little ratty-looking tail. Hopefully it doesn't progress to that point. Hopefully you get it when it's around this stage. But if you see a horse presenting like this, with this focal patch of hair loss, confined to the tail head and the perianal area, that's pretty characteristic of pinworm infection. And basically, the treatment that we mentioned there, you know, is thiobendazole, pyrantel, and you have to repeat it because, like I said, the worms are living in the cecum and colon, so it's going to take a while to get penetration to that area to actually kill them. If you wanted to do a definitive diagnosis, like I said, the eggs are laid perianally, so you use some sticky tape, some scotch tape, and just press it around the perianal area and spread the tape over a slide, microscope slide, and look at it on the low power, and you see your spindle-shaped percolated eggs, and you make your definitive diagnosis. But again, the diagnosis is usually based on the characteristic clinical signs and the location of the hair loss around the tail head of the animal. Staphylophilariasis, it's usually not clinically important because just about every cow has it. Next time you have a cow restraining the shoe, just look on the ventral abdomen, right around the midline, and you'll see the characteristic lesions of staphylophilariasis described in the notes as ventral midline. Initially you have little papules, and then they progress to alopecia nodules and crusted ulcers. So basically just seeing an irregularly outlined area of lichenification, so it's thickened, and it's also hairless lesions on the ventral abdomen. But it's usually not going to be clinically significant at all. So usually you don't have to go through any diagnosis or treatment for it. All right. All right. So the bacterial skin diseases that we're going to look at in this class are listed here on this slide. And there are a few things for you to note. When you start talking about dermatophylosis, make sure you don't mix it up with dermatomycosis or dermatophytosis. For some reason, we always test both of them in the same question, and then the confusion in your mind is dermatophylosis versus dermatophytosis. So just remember that phyto is fungus, phytofungus. So make sure you're reading it carefully. So dermatophylosis is referring to a bacterial infection. All right. So dermatophylosis, Dermatophilus convalensis, gram-positive bacteria living in the soil. And how is it transmitted? You're always tested on how the bacterial skin disease is transmitted. So it's transmitted by direct contact from horse to horse, animal to animal. It can also be found in ruminants. So animal to animal contact, or by insect vectors. So in the nose we talk about stomoxis again, the stable fly, as well as the house fly, Musca domestica. So they can also spread dermatophylosis. And also fomites. So basically when you're brushing your horse, you can spread the infection from horse to horse with your brushes. And also saddles and blankets. One thing you'll notice in the notes, we say that moisture is needed for development of the transmissible zoospores from the bacteria. So So in the history, when you read about this condition, somewhere in the question, they're gonna talk about moisture. It'll either be in a leaky barn or, you know, some description like that, that's gonna clue you in that moisture is part of the development of this disease. The lesions that you get are fairly characteristic as far as the so-called paintbrush lesions that you get from dermatophilosis. So when you look at so the skin to the naked eye looks kind of crusty, and then when you feel it, it feels pretty matted. And then when you look at it more closely, what they're calling paintbrush lesions, if you use a little imagination, when you grasp those hairs and you start peeling them off, you get this scabby crust at the base, and then you get the tufts of hair sticking out of it. So, you know, paintbrush lesions is what they look like. And so basically your diagnosis is based on the history, the fact that this animal has been exposed to moist conditions, maybe in a leaky barn, exposed to moist conditions, and a few of the horses are developing these matted hairs, typically on the dorsal surface of the animal, so along the back and along the hindquarters, you'll see the matted lesions. As far as the treatment is basically the diagnosis, first of all. The diagnosis is pretty much based on the history and the clinical signs. Just about all your textbooks talk about the microscopic examination of the exudate. So you peel this off, you press it against a microscope slide, you stain it, and then